Our next speaker is Dr. Richard Lemen.
Thank you, Celeste. It's an honor to be here, as I have been since 2005. We are all gathered here to discuss asbestos. We are scientists, we're physicians, we're workers, we're family members, we're individual citizens, and we're relatives of asbestos victims. Our friends and family members are still getting sick and dying of asbestos-related disease. Unfortunately, many believe asbestos has been banned in the United States. You're with us today because you know it has not been banned. All of us in ADAO know that this is unfortunately true, and we are working together as an organization to make this change to include America not only in this ban, but the rest of the world. Nearly 70 countries have already taken the step to ban asbestos and stop its use. According to Dr. Chris Murphy of the University of Washington's Global Disease Center, some 40,000 deaths occur in the United States alone each year from asbestos-related diseases, and this number is not decreasing. It is still going up by 200 to 400 deaths each year. Lung cancer by far represents the largest number of diseases and death from asbestos exposure, followed by mesothelioma, laryngeal cancers, ovarian cancers, as well as the non-cancerous lung diseases asbestos produces. According to the International Agency for Research on Cancer, there are also positive associations observed for asbestos-related cancers of the pharynx, stomach, and colorectum. In fact, at the last meeting of the International Agency for Research on Cancer in 2009, the working group voted evenly to include colorectal cancer as a known cancer related to asbestos. Unfortunately, as it was an even vote, it didn't get counted. Asbestosis and non-cancerous lung diseases were first suspected to be associated with asbestos, as Linda showed on her slide, in the early 1900s. And by 1930, the first epidemiological study had shown the association as causal between asbestos and lung cancer. Mesothelioma was first suspected in 1943 and later confirmed in the early 1960s as an asbestos-related disease. It's now called a sentinel disease because it is solely related to asbestos exposure. Those who continue to preach that some forms of asbestos, like chrysotile, are safe or can be safely, are not in touch with the science. Regulation in the past has played an important role in reducing the risks of asbestos-related diseases. However, it was never enough. That is why, over the past 46 years, the quest for replacing or banning asbestos has been pursued. When I first went to work for the Federal Bureau of Occupational Safety and Health, known as BOSH, in 1970, which later became the National Institute for Occupational Safety and Health, and began my research, the current methods for control of asbestos exposure were through substitution of non-toxic materials and numeric measurements for concentrations of limiting worker exposure to asbestos. As research moved forward, it became clear that no amount of regulation would eliminate asbestos-related disease or death, especially the asbestos-related cancers. Niosh came into existence in April of 1971, and with it came the mandate to recommend new health-based standards for occupational safety and health to the Occupational Safety and Health Administration, known as OSHA, and the Mine Safety and Health Administration was later added, and EPA was also created in that same time period. The very first recommended standard out of Niosh was for asbestos in 1972. And in that standard, it was recommended 2 fibers per cc as an 8-hour time-weighted average for asbestos. There had been guidance limits recommended as far back as 1938 by the United States Public Health Service, the official agency that I began working for in 1970. The early guidance limit was not a measurement of fibers, however. It was a measure of weight. And that weight, it was called a geometric or a weight measure, total dust standard for dust containing asbestos. Some years later, it was estimated that that recommendation of 5 million particles per cubic foot, which sounds very large, but to the naked eye you can't see that, was later translated to be somewhere in the neighborhood of 30 or more fibers per cc. So you can see that was a very large amount of asbestos that we have been letting people in the workplace be exposed to over the years. It was recognized by Niosh that the new recommendation was going to be wholly effective and wholly non-effective for reducing asbestos-related cancers. Or as Niosh stated in their 1972 criteria document, that control of worker exposure to the limits stated will prevent asbestosis and more adequately guard against asbestos-induced neoplasms, and it will be subject to review as necessary. Well, in 1976, Niosh did review it because we found the data that the original 2-fiber for asbestosis was based upon was incorrect. And it was from the British Occupational Hygiene Society. So we revised our recommendation. And what we said was available studies provide conclusive evidence that exposure to asbestos fibers cause cancer and asbestosis in man. Lung cancer, asbestosis have occurred following exposure to chrysotile, crocidolite, amosite, and enthophyllite. Mesotheliomas, lung cancers, and gastrointestinal cancers have been shown to be excessive in occupationally exposed persons, while mesothelioma has developed among individuals living in neighborhoods of asbestos factories or near crocidolite deposits, and also in persons living with asbestos workers. Asbestosis has been identified among persons living near enthophyllite deposits. So you see, we're talking about the 6 fibers that are regulated. Additionally, Niosh stated excessive cancer risks have been demonstrated at all fiber concentrations studied to date. Evaluation of all available human data provides no evidence for a threshold or for a safe level of asbestos exposure, as Linda said earlier. In view of the above, the standard should be set at the lowest level detectable by available analytical techniques and approach consistent with Niosh's most recent recommendations for other carcinogens, such as arsenic and vinyl chloride. Such a standard also should prevent asbestosis. The concentration at that time in 1976 was at 0.1 fiber per cc. But since Niosh determined this would only be adequate for prevention against non-cancerous effects of asbestos, they included the following statement: to materially reduce the risk of asbestos-induced cancer, only a ban can assure protection against carcinogenic effects of asbestos. This is what Niosh said in 1976. This statement brought a new consideration. We're not working now on just a number. We're working on getting rid of asbestos in the workplace. And this is very, very important date. Unfortunately, it never happened. As Linda said, the EPA tried to ban asbestos in 1989, but it was overturned by the courts, and a ban never occurred. So Niosh has continued its research, and its latest edition is something called the Asbestos Road Map, which has made crystal clear that its purpose was to develop a research agenda to sort out health and policy implications of various definitions of asbestos. Niosh's roadmap was to outline a research agenda that will guide the development of specific research programs and projects that will lead to a broader and clearer understanding of the important determinants of toxicity for asbestos fibers and explore toxicity of other related substances. Niosh recognized that the results from such research may impact, as well as occupational health and safety policies, and also recognized that the issue that we are looking at could be important not just in the workplace, but also in communities, and specifically to the general population from legacy asbestos. Unfortunately, some of us do not realize that the Niosh Roadmap is a process. It's a research plan, not a new policy statement. Niosh even states this in the foreword to their roadmap when they say many questions and areas of confusion and scientific uncertainty remain, that the purpose of this roadmap is to outline a research agenda that will guide the development of specific research programs and projects that will lead to a broader and clearer understanding of the important determinants of toxicity. To my knowledge, Niosh has not completed this research project. It's still ongoing. And ADAO has worked diligently on new legislation, not regulation, that would ban asbestos. The same asbestos materials as found in regulation today, as Linda talked to about the 6 asbestos fibers earlier. The language in the Allen Reinstein bill contains that same definition for asbestos. The action we should take immediately to act on validating these risks. And we must remember, as Sir Bradford Hill, a noted biostatistician in Britain, said in 1960, that all scientific work is incomplete, whether it be observational or experimental. All scientific work is liable to be upset or modified by advancing knowledge, but that does not confer upon us a freedom to ignore the knowledge we already have or to postpone that action that it appears to demand at a given time. As new validation and new information does occur, I would like to paraphrase Bradford Hill's comments in today's time frame. The time is now. We must not let the good, what we already have at hand, destroy what we are waiting for the perfect to materialize. So it is time that we pass the Allen Reinstein Ban Asbestos Now Act of 2022. And I thank you for your time.
Dr. Lemen, thank you so much for really putting the point that asbestos exposure, asbestos disease is a public health problem. And in public health, we talk about precaution, protecting people. And I think it's so important that we keep that in mind.